Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's Ask Dr. Pane question, we have a question from our Instagram crowd, and the person is asking, can you smoke before and after a cosmetic surgery? Dr. Pane, can you please address the hazards of smoking and what the best course is for this person?
Yeah, that's a great question. Basically, cigarette smoke, nicotine is really the problem that is involved in impairing wound healing after surgery. Now, the combustion process of smoking a cigarette creates thousands of chemicals that are not good for your body. So, when you talk about cosmetic surgery, we're talking about an elective procedure. So most people will routinely rule out anyone for surgery if they're smoking, because this is elective cosmetic surgery. This is not life-saving type work. You know, if you get a trauma or something happen to be smoking, well, they got to take care of you. Now, those of us with a lot of surgical experience will realize that although smoking is associated with problems for pretty much every procedure, depending on what you're talking about, it is most serious with particular types of procedures. So we tend to make a case-by-case assessment of what's going on. First of all, we do encourage no smoking at all. We don't routinely across the board rule somebody out for any kind of procedure. It depends on what's going on. The interesting thing is a lot of times people will quit around the time of a cosmetic surgery for the purpose of getting that surgery, and then they'll find that they've now stopped. And that's fantastic to save money and they've improved their health. Now, for certain types of procedures, when you talk about a breast lift, breast reduction, anything with an implant or tummy tuck procedures, smoking is going to have the biggest problem with those. Also facelift surgery. And that's because you're creating tissue flaps that are going to be impaired. Their circulation will be impaired by the smoking. So if someone's going to be smoking around the time of those procedures, I tell them, listen, it's better not to have that surgery because you don't want to have a problem. For other types of procedures, a straight breast augmentation, eyelid surgery, you know, some small skin moles and things like that, the problems from smoking are a lot less. It's still important to quit because you do reduce your chances of a problem. But it doesn't rule you out 100%, at least not in our practice. We do inform people what the situation is. And the way I do the procedures, even for those other kinds of procedures, are just associated with less problems than you will see in the book and in the published literature. I'm not sure what those people are doing because they have a much higher rate of problems than we are seeing in our practice. But the short answer is, there should be no smoking around the time of a cosmetic procedure. In rare cases, it might be okay to go ahead with certain smaller procedures, but think of it as a good incentive to kick the habit. If you happen to be a smoker and you want the procedure, we're going to help you along to try to get you to quit. And then a lot of times that may enable you to kick the habit permanently, and that's a good thing. So that's the basic overview of smoking, and you know, that handles most of the main issues associated with it.
Excellent. Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, Instagram account, or use hashtag AskDrPane. And we appreciate your time, and we'll see you on the next question.
Great.